Okay, this is a second last lecture. It's on the disability compensation and return to work. Okay. Um, this lecture may take a slightly longer time, but I will stop at 10:30. Then we'll continue in the next session. So next session, I will discuss with you some cases lah, and it is probably important for you all to understand and manage in the future. Now, for this session, I will continue now. Okay. So, before we proceed with this disability assessment and return to work and so on, there are three important terminology that you need to know. The first one is impairment, second one is disability, and third one is handicap. Impairment is a loss of use or derangement of any body part, organ system, or organ function. Meaning that there is an anatomical loss or functional loss. So if you have a loss of finger, that is impairment. Your lung function is lost, meaning that you cannot breathe properly and you feel tired all the time, difficulty in breathing, and it is permanent, then we say that it is an impairment. Okay, so impairment is any loss or derangement of body parts or any organ function. We call that is an impairment. Usually, impairment can be measured. For instance, you have finger, now you have no finger, you can measure, right? Yes or no. Then lung function, we can use certain spirometry tests, we can measure, or initially your lung function is 90%, now become only 70%, and so on. Oh. Usually, impairment can be measured by medical methods. Disability is alteration of an individual's capacity to meet personal, social, or professional demands, or statutory or regulatory requirements which are considered normal for human beings because of an impairment. For example, you have amputation of the thumb. Say thumb amputated, no more thumb already because of fracture or being cut off because of accident. Now, if you are a writer and you need to write, you have to use your fingers to write, or you have to use your finger to type. Because you have no thumb, you cannot type anymore, or you have the disability to type. We call that disability exists. Same person, you amputate the thumb, but you only use your voice. You are the singer. You don't need to actually use your hand. Then there's no disability. So, disability is related to capacity to meet personal demand or occupational demand. So impairment does not mean that you always have disability. Disability is always caused by certain form of impairment. So you have to understand this concept. How about handicap? Handicap is a disadvantage for a given individual that limits or prevents the fulfillment of the role that is normal. You cannot fulfill the role as a normal person, school or community, at home, etc., any form of activity or in the workplace, then we say you have a handicap. You cannot fulfill the role as a normal person. For example, your company is in the floor, when you have a fracture over the rolling, and you cannot walk, you have to use a wheelchair. But there's no lift, you know, up to the company. So meaning that you have a handicap. It is not related to your disability, because you may be a typist, only sit on the table, you can type. You don't have a disability. You have fracture over the lower limb, but you cannot go to the your company because you cannot climb up the stairs. You have a handicap. Okay. So you have to understand this terminology. Impairment, disability, handicaps are three different things. So impairment can lead to functional limitation or disability. And sometimes the functional limitation or disability can also lead to further impairment. So disability is a relative, is a relational outcome. It depends on the work demand. It depends on the environmental conditions of which you need to carry out certain particular job. So, traditionally, WHO we have certain model of disablement lah. People thought that you need to have certain illnesses first, pathology or disease. Then you followed by uh, say you have an injury, then you end with impairment. Impairment leads to disability, and disability leads to handicap. These are the traditional belief that people say that impairment has to be caused by certain pathology, disability has to be caused by certain impairment, handicap has to be caused by disability, and so on. Over the years, people found out that this is different. Sometimes disability can lead to further impairment. Or sometimes certain impairment can rise to another types of diseases and so on. So, in the new model, based on WHO International Classification of Functioning Disability in Health, we come up with this complex model of disability, handicap, and impairment. And you notice that everything is related to each other. It is very important because when we manage the cases related to impairment disability, we look at all aspects. We don't look at one direction, but we look at both direction and make sure that certain impairment will not cause other form of disease, and make sure that certain disability will not further cause impairment and so on. So nowadays everything is related to each other. Environmental factors, personal factor can affect a person's disability status, and the illness, this disability status sometimes can give rise to other health condition, and this health condition can cause a disability and so on. So it's all interrelated. Model. So sometimes people misconcept that the people with this disabled person is unable to work. Or disabled person are ill and suffer from medical condition. Or you said the being disabled is a tragedy and must be cared for, and disabled person can play no role in workplace, uh, and so on. So these are all misconception, because disabled person can still able to work depending on the type of job, as long as even say you are disabled for certain work, but you may not be disabled for another type of job, because it is all related to matching your impairment with the job demand. If you have certain impairment but the job demand does not require you to perform with that kind of impairment, then you has no disability at all. So no issues on that. And disabled people are not really ill; they are just disabled for certain tasks. Okay, and if you manage your workplace environment, you can actually accommodate the disabled person or disabled workers, depending on the type of job. Okay. So we should have this proper concept lah. Disabled person only becomes so because of the barrier erected by the society. And if you provide necessary facility, then they can still perform the job effectively. Again, it depends on the type of industry. In other countries like European country, they have disability discrimination act, which is to provide uh, provision to provide the law to protect the disabled person from being discriminated in terms of employment. In our country, we don't have this law yet. Maybe in the future, we might have it. So we come back to the evaluation part of impairment. So just like fitness for work, impairment evaluation is a medical evaluation, and it is also carried out by medical doctors. And we measure the deviation from normal, depends on the type of the deviation, and then um, we can look at the anatomical deviation or physical abnormality or physiological abnormality or psychological abnormality. So there are guidelines on how to measure this impairment and so on. So usually OHD who are good in doing this are the one who has been trained under the medical impairment assessment course. When we do the medical impairment assessment, like, we follow this the guideline, or this is like a Bible for all the medical impairment assessments. MA guide, American Medical Association guides to the evaluation of permanent impairment. And over the years, now it has come to the sixth editions. This guideline is developed by the expert. It is tested, uh, time tested over many years already, widely accepted. And this is the guideline that used by SOSO as well. Okay? And it is to perform by medical personnel and need training to perform that. And we perform the medical impairment, impairment evaluation, to monitor the progress of disease, to estimate the level of disability and fitness to work, and also for the purpose of financial compensation. And the third, this purpose is more common. So a lot of time people go for impairment evaluation is for purpose of insurance claims and so on. Even so, the main aim is for the financial compensation purposes. Like I said, when we do impairment evaluation, the idea, the philosophy is not restricted to financial compensation. Can use the result to monitor the progress of disease, and we also can use the result to estimate the level of disability and decide on the fitness for work. Okay. In terms of compensation, we have private insurance and social insurance. I think you all know about these things. Okay. Malaysia, social insurance is administered by ESO or SOSO. SOSO is a BM. Also is in English. It's the same thing. So is a social insurance. Now, social insurance, just a few words about social insurance. The coverage is usually compulsory, and the scheme is usually contributory. And the reason that the coverage is compulsory is because they don't want the voluntary coverage. Voluntary coverage means that um, the rich people will be able to buy the insurance, and the poor people will not be able to buy the insurance. So at the end of the day, only the rich people got cover, people got not cover. So it's not fair. So that's why social insurance is compulsory for everybody at a certain level, and the aim is to make the workers actually not to make fit. Although it's also a lot of income, but actually a lot of money is used for the benefit of people. If you see project done by SOSO, there are actually a lot. They have their own rehabilitation center, and then free for the insured person. They carry out free health screening program, etc., etc. So actually, if you ask me, one of the OH institution done good, in our country is actually SOSO. SOSO has been doing a lot of good job so far. Social insurance, the risks are poor. The uh, scheme stress on the social adequacy over individual equity, and contribution and benefits are earning related. Okay. And social security organization is provided under SOSO Act. Is mainly for social protection of the employment and so on. So nowadays they cover a lot of things, including employment injury, unemployment invalidity, and all the benefits for the injured person. You can browse their website. There are a lot of information there. Okay. And it's to provide protection for uh, for decent standard of living as a result of loss of earning, promote health, provide assistance to family, and so on. So I have three schemes. I think this one you can read in detail. A lot of information in the website also. They have employment injury scheme, invalidity scheme, employment insurance system. Last time there's no employment insurance system. So I don't know starting which year they start to have this employment insurance system. I think which is quite good. In the long time ago, there's only employment injury scheme and invalidity scheme. Now, these two schemes is compensation for medical illness lah. Employment injury is for occupational injury or occupational disease. Invalidity is for any condition that either a person unable to work anymore or then he's uh, eligible for invalidity pension. Okay. Now, under this employment injury, we have temporary disablement. This is where the disability concept come in. So the also will usually ask the injured person arrange a section, medical board section. Medical board usually consists of 3 doctors lah, one OHD, one general physician, and one surgeon. So 3 doctors. So these 3 doctors will assess the disability of the insured person, decide whether this disability is temporary or permanent. If it's temporarily, these 3 doctors will decide the level of impairment. Then the SOSO will give this compensation according to the level of disability. In terms of temporary or permanent, depends on the OHD, and it also depends on the number of medical leave. If the condition not permanent, then the SOSO will compensate their sick leave, medical treatment, etc. If the condition is permanent, then the SOSO will give a disability compensation. Okay, and level of disability has to be assessed by the SOSO board. So there are 2 types of disablement. Validity also has to be decided by SOSO board. So SOSO board have to decide whether this guy is eligible for invalid or not. Yes, then he will get pension amount. Okay. So like I said, your company, if you have worker send for invalidity pension, then that is automatically considered a medical product of your company already. So I write a worker who receives an invalidity pension, he cannot work anymore. He should not work. He should not receive salary at the same time also receive invalidity pension. That is not fair. Employment insurance system is to cover financial and job search assistance retrench employee. This one is not related to medical compensation. Okay. It is mainly for those people who lost their job, then it's also try to cover financial assistance and job search assistance for them. Also medical board is to determine occupational disease and to verify permanent disablement status, decide on the permanent disablement percentage, and also to verify invalidity application. So these are the 4 main purpose of a social medical board. And like I said, it consists of 3 doctors. At the moment, it's only available in government hospital. And last time when I was in the government hospital, I was the member of the social board as well. In order for a doctor to be in the social board, we have to undergo 1 week training organized by social and being certified as a medical impairment assessor. So there's a term called independent medical examination. Basically, it means that medical examination has to be carried out by a person who is a doctor, assess the extent of the ability. Okay. And it should not be carried out by a doctor who are treating the patient because they may be biased. That's why it has to be carried out by independent medical examiner. Or in US, it is called Certified Independent Medical Examiner (CIME). In United States, all these CIME have to go through this training using the MA guideline, and they know how to carry out certain assessment properly. In this independent medical examiner, there's no doctor-patient relationship or doctor-patient privilege because the doctor is not the one who treat the patient. And he's totally a third person. and and the judgment is impartial, unbiased, and is objective. So, in US, those who are undergone this training is called CIME, Certified Impairment Medical Assessor. In Malaysia, we have equivalent which is Certified Medical Impairment Assessor. Oh, in US, it's called Certified Independent Medical Examiner. Different terminology only. The training is provided by a NAPOS. Usually, the course is run by SOSO, and all the doctors who in the SOSO medical law have this certified medical implement assessor certificate. So for us, we follow this guideline. So basically, this guideline is referring to the MA guides lah. This is a world standard guideline. So simplified so to make it easy for local use. Okay. So there are few conditions. Early disablement is a condition resulting from employment injury that requires medical treatment. Whether this employee temporarily incapable of doing the particular job. Also, if it's only temporarily incapable of doing a job, we call that temporary disablement. Permanent disablement is a situation of which is permanently unable to carry out a particular job. However, permanent disablement can be further divided into either it's partial or full disablement. Partial meaning that it is not 100%. Okay. It reduces the earning capacity partially, but not 100% disabled. Uh, if it's a permanent full or total disablement, then is 100% cannot perform that particular job. So for that, compensations is higher. In SOSO, another terminology called maximum medical improvement. This is the situation of which the person illness come to a certain extent that we cannot improve anymore. That is a maximum medical improvement. So if the maximum medical improvement have achieved and he is still having disability, then we call that the disability is permanent. So the doctor have to assess whether a patient's condition already achieved the maximum medical improvement or not. Once he achieved the maximum medical improvement, then only we send this guy for disablement assessment. So usually in the social board, if a particular workers come to us with certain illness and we found that hey, he can further improve, then we will ask them to come back again because we couldn't assess them. You assess now, then later he will improve, then it's not fair to social also. So that is what we call maximum medical improvement. So sometimes you might receive a report from social of some of your workers saying that the doctors put that the maximum medical improvement is not achieved. Okay, then disability assessment cannot be decided. Come back again in few months time or something like that. So this is what they mean by maximum medical improvement. There's another condition when we do the impairment assessment. We notice that the certain impairment is not fully due to workplace. It is contributed by workplace environment, but it can also be caused by certain behavior of the workers. Then we do apportionment. Example is, for instance, this guy having a restriction in the lung function, and he is inhaling the chemical in the workplace. So following the assessment, we noticed that he got 20% impairment of the lungs. Okay, 20% impairment. Because this guy is also a smoker, chronic smoker, and smoking can also reduce the lung function. So as a medical doctor in social board, we will do apportionment. Okay, this is based on subjective judgment, looking at the history and so on. Then we might say that out of the 20% of lung function impairment, only uh, you know, 10% is caused by smoking, another 10% is caused by workplace exposure. And the apportionment become 10% rather than 20%. Okay, so that is the meaning of apportionment. Okay? We only do that if there is a real justification to do to that lah. Sometimes also request for apportionment, because they want to be very specific. Compensation that they pay is for the disease, it is for the occupational disease, not because of the lifestyle behavior of the workers. Okay, so this is where the apportionment come in. So the apportionment is done by the doctors, and then it's based on the subjective judgment, or it is based on the reasonable probability lah. And in the board, there's three doctors, so three doctors have to agree on 10 apportionment. Then only they can sign the forms. Okay. So the last one is invalidity. Invalidity, if you look at the definition, it says here that invalidity is a condition of which a person is not able to earn one third of the customary earning of a mentally and physically sound person with similar qualification and training, so on. So it means that the person, if because of certain medical condition, is not able to earn more than one third of what he should have been, then we can consider that this guy is invalid anymore, meaning he cannot perform the job anymore. However, this is a definition in the law lah. However, how do we decide it is one third? So it's very difficult. So at the end of the day, so-called the doctors is based on the medical judgment. And sometimes some doctors sometimes we use the impairment assessment to justify. So if he has impairment more than 66.6 or maybe 70%, then we consider that he is invalid. So sometimes we use that kind of a guideline to judge whether a person is invalid or not valid. For a very clear-cut situation, then this is not the issue lah. For instance, we have a stroke patient. Patient stroke, paralyzed, not work anymore. Nowadays, we have to issue the invalidity certificate. So if he invalid, then he will get the invalidity pension, and the company can medically board up him safely. So that is the invalidity. Okay, so I think we'll stop here. I will talk about return to work in the next lecture, then followed by case discussion. So far, you have any questions or not? Right, questions?